Al Jazeera's James Bays spoke to Dr Tanya Haj-Hassan, who is a malnutrition specialist. She says treating starvation is very risky, as giving salts and food to a patient suffering from malnutrition can be dangerous.
These shifts can be life-threatening, and so they need to be fed in a very intensive way. The reason that's the case is because malnutrition impacts all aspects of the body's function. It's the fuel for your cells. And so when your cells are starved, it impacts essentially every organ in your body. We, I guess, colloquially think of it as, low energy, not enough sugar to burn as energy, and then you lose fat, and then you lose protein, and you end up losing weight and looking quite thin. But in reality, all of the cells in your body are altered by this. In your intestines, the villi, so the cells lining your intestines, die, and that results in issues with absorption, bacterial overgrowth. Your pancreatic suffers, so you struggle. Pancreas suffers, so you struggle absorbing fats. And that means that even when you're fed, you can't necessarily absorb the calories. You end up with diarrhea and losing a lot of fluids. The cells in your heart become very weak and thinned, and they have poor contractility. Their connections are also impacted, so that the heart rate slows quite a bit. And these children often die of heart failure or life-threatening changes in rhythm, even during the period where they're being, and sometimes especially during the periods that they're being refed. They also have life-threatening shifts in salts. And these can also lead to fatal heart rhythms. They're more prone to, everything life-threatening, from sepsis, as someone just mentioned right now, to shock. I think it was Dr. Ahmed that mentioned that the baby, I think her name was Zainab, also had sepsis. So sepsis, shock, other infections, including skin infections, particular ulcerating skin lesions, low blood pressure, inability to maintain body temperature, so hypothermia, fluid overload, especially when you're refeeding, fungal infections, acute vitamin deficiencies that threaten even your vision, can cause alterations in your bone growth for children, and so on. And then, of course, for your brain, which is the long-term impact that we talk about a lot, for your brain, it can result in death of brain cells.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.